just listen to it carefully because this has been drafted by the government of India. Quickly go ahead with this, please.
Can you show?
Thank you, Dr. Gupta. We are honored to listen to this future of the India presentation. That's great, and we are honored to have your son present this.
Okay, I'm Dr. Chinmay Gupta. I will be presenting on healthcare goals of Viksit Bharat, building a healthy India by 2047. So we all know that Viksit Bharat 2047 is India's national vision to become a developed nation by its 100th year of independence since 1947, focusing on economic prosperity, social inclusion, technological advancement, and good governance, built on key pillars like youth, poor women, and farmers with active citizen participation encouraged through initiatives like the Voice of Youth platform. So it basically has three major pillars like self-reliant nation, key pillar is healthcare, and inclusive access. So as we all know that Ayushman Bharat, it is the world's largest public health coverage, launched in 2018, and it covers over 42 crore vulnerable Indians with health insurance of 5 lakh per year per family. So till now it has saved families approximately 1.52 lakh crores in out-of-pocket expenses, and also with primary care network. So digital transformation in healthcare, it includes digital highways, data integration, and telemedicine boost. So as we all know that future of Viksit Bharat lies in preventive healthcare with like key components of proactive wellness, economic multipliers, and on-site health centers. So strengthening of health infrastructure. It is launched with the PM Ayushman Bharat Health Infrastructure Mission, which was launched in 2021 with facility upgrades, block public health units, and integrated labs to enhance diagnostic and research capacity. So inclusive healthcare, reaching every citizen like rural and vulnerable focus, livelihood guarantee, and accountability and good governance. So what are the key targets for 2047? Like universal access, affordable quality healthcare available at primary, secondary, and tertiary levels, skilled workforce, health security, and resilient systems. So inspiring success stories involve Ayushman Ve Vandana, like nutrition schemes and digital health ID, which has transformed the patient experience and access to specialists. So we all hope that a healthy India is a developed India, and we hope that we are able to give a developed India till 2047. Thank you.
So it gives you idea about how much the muscle has been lost because of the infarction. Now this is a new classification of acute myocardial infarction type videos on wherever the board the YouTube
option. In a tissue valve, if it fails, TAVI can easily be done in such patients. Like for example, in this patient, failed aortic valve, prostate tissue valve, and a TAVI was done in this patient. In the interest of time, just running through the slide. In this patient,
ICH supplies 20% of that, RC supplies 30% of that. This is the usual scenario, but it's not that every patient will be like this. Some patients LAD might be supplying 70%, RC might be supplying 60%. So it is different for each and every patient.
Is under development, and the cost and the pen size are not being disclosed. So regarding this few points about trials, the onward trials with insulin icodec and Quint trials with insulin hypertrophic.
And that is what the most important thing in this particular subject is. We had an LV which is significantly hypertrophic, and look at the LS size. The normal LS size is only 40 millimeters.
Without stent, 1977, 16th April, and in 1887, the same person had a patent left pain without stent. But restenosis was a major problem. We know 30% restenosis at that time with the balloon angioplasty, and therefore stents came up. And then stent also had the restenosis, therefore drug-eluting stents came up, the first generation, second generation, then sinovelous coating is
of comorbidities. So then most probably you will go slow, and HbA1c of 7.5 and 8 is acceptable. Somebody who is like 25 or 30, so we keep on having this, the people with diabetes who are comparatively young. In the Indian population, we have a lot of young type 2 diabetes. Even in adolescents also we have type 2 diabetes. So these are the ones.
Intracranial hemorrhage and stroke. It also improves the long-term survival of the patient. So it follows the majorly 3 steps: mechanical reopening of the artery, balloon angioplasty, and stent placement. So before the PCI is done, there is door to balloon timing, which defines the quality matrix. So it is a critical performance indicator measuring the interval from moment a STEMI patient arrives at the hospital door until the inflation of the balloon in the culprit coronary artery within the cath lab. The guideline says that it should be equal to or less than 90 minutes for centers capable of performing PCI, and the
sympathetic innervation of the pancreas as well as of the liver. So these are the important changes, and that means more insulin is secreted, and that improves diabetes control.
Any other question?
Instituted in this patient, and the patient finally survived. Another case of left main occlusion, cardiogenic shock. As you can see here, a protected. Yes.
Okay, thank you very much, Deepak, and it was lovely having.
I think it was some place which is very common. A lot of the rich people were staying there, and you'll be surprised. They had got huge varicose veins, and they never worried about these varicose veins. They just continued to say that nahi, kuch nahi hota. This, it will go into everything, and here it is, which is, you can see that.
Killer of the human being is cardiovascular disease and no other disease. Burden of cardiovascular disease is increasing, and for some peculiar, unexplained reasons, the Indian and Indian subcontinent area has the highest prevalence of cardiovascular hypercholesteremia. If the child has other risk factors like obese, smoking, hypertension, diabetes, wear helmet. Tell them in the class 4, 5, 6.
Alter the LDL levels. So what is how to look for that? So there is a correction factor for each statin, like atorva, rosuvan, and ezetimibe. There is a correction factor. So I had a patient a few months ago who came to me with acute MI, and he was on 20 milligram of atorva statin, who is a carrier of FH.
We have beautiful agents now on our pen. Our pen has a lot of power now. We can reduce the weight as much as by 15 to 24%, be it step trial, be it surmount. And now we have retatrutide coming, which has equal. The body is physiology. So person is not to be blamed. We have to design things in such a way that a high energy, the volume, and modality can be high, include brisk walking, running, and structured high intensity interval training. What are these high intensity interval training? So there is a concept of maximum heart rate.
These results were for many of us surprising, and I like again to share them, but also to give my idea of how I interpreted them. But let me anticipate what is the outcome of the shortcut and the victory trial, not both of them published, but I think interesting trial of relatively limited number of patients of OPM balloons compared with intravascular lithotripsy with 3-0 before the 1.
Dr. Sievert is online? Okay, Dr. Sievert. Dr. Pisiras, would you like to chair this session? Okay, he's there around. Dr. Sievert, we can start your talk. Dr. Carlo Di Mario is also there, and we can.
The intracranial vessels, 1.2 millimeter PCI balloon, and this is the excellent result after balloon angioplasty in this case here. But again, ballooning is rare that we use this in intracranial vessels. Another case, a 95-year-old case at the other end of the spectrum, middle cerebral artery is occluded, reocclusion after multiple attempts using. And right from the clinical
Indian scenario and very commonly treated condition, the indication for percutaneous mitral commissionotomy experienced heart valve centers. When this is the emphasis that has been given time and again, and I just put this slide because very recently our women's team from India actually won the World Cup because of their consideration as a team approach, as a first, second, and third options for them to go for the win. I have not gone.
I think it's a condition where very rarely you have much calcium in the valve.
So coming on to how the development took place, developing TAVI, a long road littered with pitfalls, lesson learned from the experience of future innovator. What he says is having an idea is not enough. This is for the learning for the future innovators. Translating it into reality requires a combination of elements proving that your idea is good, number one. Mental strength capable of overcoming the criticisms, number two. Finding the right partners and the finances to advance, number three. And rigorous scientific research, respecting the process of optimal translation research. Failure of any of these elements can lead to failure of the entire project. This is what Kreber is writing. Never give up. Perseverance is the key word. So, development of two successive innovation for the non-surgical treatment of acquired stenosis. At time. So, this is the slide which I want to show you. 37 years is BAV, 32 years from FIM. Now, this is for 1985, first BAV, 94, the autopsy study, 99, the PUT company, 2000, animal experimentation, 2002, RUA first in man, 2002 to 3, RUA feasibility study, 2004, Edward Life Sciences, 2007, CA mark, commercialization, then new value strategy, partner 1, partner 2, and partner 3 trial, and of course, further expansion of this novel technology. So he says, never give up, but your idea has to be seen and noted by many people who should sponsor it. This is a slide where myself and Dr. P.C. Dutt were there in this ceremony. This was 10th year, and then we went to 20th year celebration also. Thank you very much. And so I wanted to just tell about my heart for Alakribi Kalro, my Amaru is listening. And so Dr. Egypt, Dr. Gaza.
In the orbital to prepare the brain, and then also the calcified valve necessary. Imaging an FF1 are optional, but you should, if you are doing it, you should see that no flow limiting dissection, and the FF1 should be less than 0.075. Residual stenosis should be less than 30%. Length and the top of the balloon, length of the balloon should be 2 millimeter both sides, so it would be 18, so 22. Bifurcation in the sideband drop-coated balloon, it was result was much better in the treatment of coronary bifurcation lesion. PCI changing and the emphasis now on metal-less PCI. Adequate lesion preparation is key for the success. DCP is now class 1A recommendation for
French, an angio is obtained in REO to assess precisely the location of the puncture site, which might be useful in case of any need for covered stent at the end of the procedure. Next step, the Lima catheter is replaced by a 6 French pigtail used for doing the supraortic angiography, looking for the optimal working view, showing the cusps align. In general, this view is predetermined by CT and heart navigator. Here, the working view will be LEO 15, caudal 10 degrees. In this case, as we will see, 2 proglides have been used for pre-closing. Christophe is doing here the usual maneuvers. The device is advanced over 0.035 wire at 10 o'clock and the wire removed. He looks for an optimal backflow before deploying the what is achieved using the contralateral Lima catheter. In this case, as in the majority of cases, there is no vascular complication and no bleeding from the puncture site. It's perfectly dry. The contralateral femoral artery will be closed with an angiosealer. This procedure lasted 30 minutes from skin to skin. The left bundle branch block disappeared at 1 hour, and the patients could be discharged at day 2. Congratulations to the operators. Thank you very much.
So this was the horse's mouth. I mean, can we have the Zoom people who are situated?
Dear colleagues, since the first
angioplasty was carried out with the same
in the voice.
By IVUS was around 4.2, and actually the stent was deployed, the old stent was 3. Before the era of IVUS, usually we utilize.
We have now about
Standard. And so we went to the anatomopathology lab and we implanted a stent in the aortic valve. And this study on cadavers demonstrated that it was possible to enlarge the native aortic valve, open it by placing a metallic stent, and that you could have a very circular opening of the stent, and you could respect the surrounding structure. Coronary arteries above. All the credit goes to his incredible idea.
Not only idea, but he did it.
He did it. He did it.
That's
You're right.
important.
Yes, he did it.
Despite the chronic and Edwards refusing to complete.
Document we published last year, we basically, this is something for CTO, but it's also for complex lesions. We also are giving a lot of value to symptoms evaluation, which is not only anymore angina, but also dyspnea and health status. And also, when we look at the clinical, not only the new drug-eluting stents, but also the new reabsorbable scaffold, the new half metal, half biodegradable stent, and polylipid scaffold, which is all coming together with drug into the clinical.
So I hereby welcome our chief guest the evening. Although I would say chief guest of honor, our chief guest is Krishna Bhagwanji, and our senior most or chief guest of honor is Mr. Ramdas Athavleji, who is a minister in the Union government with Modi's government. We have still lectures going on, but I would like to interrupt there, and we can have stop. First of all, we would like to honor him with a bouquet. Sir, आगे बैठिए. तो पौने 4 बाकी हैं और
hospital because I'm not patient. Because there is no any problem in my heart. Because my heart is okay, therefore I can't go in the Apollo hospital. But we Guptas, near about 11,000 heart operations. 11,000. And he is also trying for Padma Shri, definitely in this year. I will recommend your name for Padma Shri because you have given the life to near about 11,000 people, 11,000 patients. And today, 22nd, Indo-European course on revascularization, and 8th Indo-European and American conclave. Many delegates are also present here from दवा खाने के बजाय 1 घंटा.
A video message from Honorable Rajnath Singh ji, who is Defense Minister of
the conference.
Impactful workshop-based conferences which meaningfully contribute to advancing national healthcare goals and align with the Honorable Prime Minister's vision of Viksit Bharat 2047. Thank you very much.
दवा खाने के बजाय
Joint efforts of Professor Dr. Vivek Gupta and Professor Dr. Previous of France, the conference began its journey at Vigyan Bhavan, New Delhi.